Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Today I wanted to talk something about hormones. Yes, they are very important in terms of childbirth and in terms of giving us that natural birthing experience. And it is how the play of hormones uh, depends on what kind of an outcome that we get. So, this Saturday, I wanted to have a very interesting topic, a topic usually people don't discuss. But yes, on the other end, everybody has the right to know about what hormones are and how the effect of hormones is on childbirth. And when we have to talk about hormones and their effect, the play of hormones is always there when they are released in your body under the influence of circumstances. Okay, so when the hormones are released in your body under the influence of circumstances, it is about the circumstances that give these kind of hormones. It goes by saying, not it goes by saying that whenever there is an influence of external environment on your hormones for the woman who is in labor and delivery, so it is more about the influence of partner, it is more about the influence of people around her family members, friends, doctors, nursing staff, the environment in which she is delivering, whether it is peaceful or whether it is chaotic or whether it is maintained in that natural method, or everything is hush bush everywhere. So it all depends, and the influence of so many environmental factors are there in the production of hormones of the delivering mother. And when we have to talk about birth hormones, what is their role in the woman? They actually get your body ready for the delivery process. They start your labor contractions. They prepare your labor. They prepare the baby for the labor and delivery process. And yes, eventually they are influencing the lactation process, and they make the breast also ready for the baby to, latch onto. And when we have to talk about the influence of hormones, they influence the baby also that much. How much they influence the mother? They influence the baby to fall in love with you, and the baby to latch the mother, and all these things which actually occur very normally in every pregnancy. There is nothing actually that you have to do to increase the bonding between the mother and the child. The hormones already make the baby ready for these kind of things. And when we have to talk about the hormones of labor and birth, the first and the foremost hormone that I really wanted to talk about is oxytocin. And other than oxytocin, also we have so many endorphins, we've got adrenaline, and in the end, prolactin. So when we have to talk about oxytocin is the hormone. Basically, if we have to talk about oxytocin, it is the hormone of love. And whenever there is release of oxytocin, you have that very good feel good sensation. And oxytocin releases when you love each other, when you hug each other, when you cuddle with each other. So this is a feel good hormone. It is the hormone that is there in lovemaking. It is the hormone that influences fertility. It is the hormone that influences contractions during labor. So there are so many positive effects of oxytocin, and that is why it is called the hormone of love. And your body gradually and naturally increases the hormone oxytocin secretion in early phase of labor and latent phase of labor. That is when early you're getting small contractions. That is when this oxytocin starts increasing, and it even steps up in such a way that you go through labor and delivery smoothly. And you have oxytocin receptors in the entire body, and they are very sensitive receptors, and oxytocin stimulates powerful contractions of the uterus, and making the birth canal open, and pushing the baby down with contractions, and the delivery to progress. And um, it also is involved not only in contraction of the uterus, it is also involved in making the pelvic floor open and making way to the baby, so that delivery contemplates on a very smooth basis. And when we have lesser amounts of oxytocin, what happens is the contractions are slow, or they fade away, or they go off, or they can cause excess bleeding once the delivery happens, and we have to have extra interventions. And now, how do we even promote your natural body oxytocin to prevent these things from happening, to prevent the contractions from fading away, to prevent overbleeding, or to prevent any unwanted interventions? It is very easy, and it is in the hands of the woman laboring, and also the partner and the family and the surrounding. Actually speaking, you have to be very calm, comfortable, and confident. That is very, very important for the natural release and the work of oxytocin to go on in the labor room or wherever the place you're delivering. It is important that there should be no disturbances. There should be, people who really support her, and not unwelcoming people saying that, why do you want to go into all these things? Get an operation done, get a cesarean done. They are pessimistic people around a delivering mother, and it always happens, and it creates a negative emotion. And whenever somebody is trying naturally, if people around them are pulling them back and giving them alternatives for a natural phenomena, absolutely not warranted. At times I even get so frustrated and ask them, this is not the right time for discussing such things. She's going through labor and delivery. If you have any objections on that, you can stay home, and please leave the hospital, and do not demotivate her, the pregnant woman who is in labor pains, to get a cesarean done and to go through something. They call it as a shortcut to normal delivery and bearing pain. So it is absolutely not warranted. And by walking around and being as normal as possible, and being in an upright position, also enhances the oxytocin production. And there are certain small things that people can usually do, like stimulation of the nipples, stimulation of the clitoris, a stimulation of thinking good, and visualization and birth visualization. All these things help oxytocin release, and also they enhance at a later date breastfeeding in the mother who has delivered. And there is one thing that I always say, that women do ask for epidural analgesia whenever they are in labor. That is one of their birth plan that they have. But I tell them that there is one point when epidural analgesia, that it can decrease the inherent oxytocin levels, because it takes you away from the feeling of labor and delivery, and it does not promote the oxytocin that it naturally comes from a natural birthing experience. So wherever possible, you should have a natural birthing experience. Avoid epidural analgesia unless and until it is absolutely necessary, and you are a person who's very freaky about pain and all these things. So there is very good evidence saying that if you avoid epidural analgesia, you will have better functioning oxytocin, better release of oxytocin, because the body mechanism is truly running by itself and funding whatever required for the pregnancy and labor all by itself. And that is really, really important for somebody who is contemplating a natural method of labor and delivery. And the second hormone that comes in is endorphins. When you face any stress or pain, your body itself produces enough pain relief hormones, and this hormone is called endorphin. So endorphins are very, very important in terms of giving you that pain relief. And it can be not only labor pain, it can be any pain in the body. Your endorphins, your body mechanism releases these endorphins as a part and parcel of pain relief from the body mechanism. And the endorphins increase to a very high level during labor and delivery to support the process that is happening. And they take the mother into an altered state. So whenever there is pain, whenever there is endorphin release, and to very high extent in labor and delivery, they make the mother do not understand this pain as pain, and they take her to a different these endorphins take her to a different level of consciousness, where she is not under the influence of pain, but she is under the influence of the endorphins that are released in the body. And they have that strength that they have to go ahead with labor and delivery. And that is why you say that laboring women are in a euphoric state. Even after delivery also, they are in that euphoric state. And postpartum also, endorphins play a very, very important role in strengthening the mother baby relationship. And a normal endorphin level is very, very necessary. Whenever the endorphin levels fall down suddenly, they cause this postpartum blues and depression and all that. So endorphins are very important, and they continuously keep increasing as the labor progresses, and they are peak even after labor and delivery, so that the woman does not go into any kind of depression. They are the ones that keep up to that labor process and cooperate the mother naturally by the mechanism of the body. And low levels of endorphins can cause extreme painful contractions by her. Sensation itself is extremely painful and difficult to tolerate, and we have to give some additional support to such people. And how you can enhance the endorphin secretion in your body when you are in labor? That's very easy. Again, staying calm, staying comfortable, staying confident, and avoiding disturbances and unwelcoming people in that place, and delaying any kind of external stimuli or external interventions. So whenever the body itself is taking the woman through labor and delivery, any untoward exposure from outside, any untoward measures from outside should be stopped, so that the flow of endorphins happens. For some people, whenever they say it's extremely painful, we start giving medications and opioids and epidurals and all that. This again takes away the natural mechanism and takes the natural mechanism of pain relief and natural mechanism of defensive action of the body towards the labor process. And endorphins are really, really good, and the kind of cooperation the partner gives in, the family gives in, it further enhances the confidence that you give to the delivering mother. It further enhances the endorphins in her body, and it helps have a natural vaginal delivery. And the third hormone that I wanted to talk today is adrenaline. Adrenaline is a fight or flight hormone. So that is a defensive hormone that releases whenever you are in danger. So it is produced to help survival, ensure survival. And for example, if you have severe pain and fear, so that is a hormone that releases. And sometimes a very high level of adrenaline can be released if the woman is really fearful. For somebody who's not gone through any labor classes, or who's not gone through any they have that extreme fear of labor and delivery with others' experiences, they have a lot of adrenaline release. And at times it is so bad that abruptly labor stops and it does not progress. This is the reason why at times there is so much of so much of delay in labor that is happening. So it is actually your adrenaline that is released from your body, which can slow or stop your labor altogether. This is actually a method wherein it calms down the woman naturally. So if somebody who's not in the hospital, at home, who's delivering and who's very frightful, it immediately gives some gap, and then it allows the woman to prepare again confidently to go forward. So too much of adrenaline can cause problems in labor. Sometimes it can cause distress to the baby. Sometimes it can cause contractions to stop. or have erratic painful contractions, and it lengthens the labor process, and it creates a sense of panic, fear, and increasing pain in the mother. And again, this kind of a phenomena that is happening, and which is absolutely not controllable because of the release of adrenaline. At times they even rush in for a cesarean delivery, especially when it causes heartbeat problems inside the baby. So how can you keep the adrenaline level down during labor and delivery? By staying calm, comfortable, and relaxed. Always I insist on the antenatal classes and yoga sessions and Lama's childbirth education sessions, so that the delivering mother and the partner in support, along with the family, knows what is happening. They are prepared for the D-Day. And you should have always, you should trust your body and have confidence in your capabilities of having a normal vaginal delivery. That happens with birth education, and that happens with the by enhanced support that is given by the care providers, and the birth setting, the doula, the labor room sister, the physiotherapist, the massage therapist. All these people give that kind of an encouragement, and always a peaceful, calm environment works very well. It does not allow the adrenaline to rush into the body. And a very good partner in support is really, really important to give this enhanced benefit. And whenever there is good information, good words, positive thoughts, adrenaline is very much under control. And uh, whenever, we should not trigger pain in pregnant women, and everything should be so comfortable, and you should talk to her whenever you're doing any procedure or checking her, so that she does not have that fight and fright and then release adrenaline, which will block the labor and delivery. And the last hormone that I wanted to talk today is the very good mothering hormone, that's the prolactin. And how prolactin helps in lactation and establishment of breast milk and feeding and all that, everybody knows. But the prolactin release around the time of birth has been less researched. But yes, it increases during pregnancy and peaks when the labor starts, so that it prepares the body for labor and delivery to happen. And it is one of the hormone that it is keep getting the body ready, or they're getting the woman's body ready for breastfeeding. And it also improves labor and delivery process. And that prolactin is a central hormone for breast milk production, and high levels of prolactin are very good for early breastfeeding, and very good bonding between the mother and the child. And there are certain conditions where there are low levels of prolactin causing a lot of problems, especially whenever the mother and the child have some gap between bonding because of various reasons. And sometimes if there is poor growth and development of the baby, or a preterm baby, there is a lag between the latching and lag between the access to the mother and the child naturally. And there are at times fearful women who fear of the nature of breast milk giving, or the nature of breastfeeding. They have their own notions. In such people also, the prolactin levels are low, especially if you're not very self-confident, and if you're not very confident of your womanhood and what you can do as a mother. Yes, there are different kinds of people. There are women who are not very self-sufficient in their thoughts. They are fearful, and they have their own notions. They carry over by others' expression of their fears, and they influence their own pregnancies and their own outcomes. So in such conditions, the prolactin levels are a little lower. But yes, you can promote your natural production of prolactin in your body by preparing your body for labor and delivery, doing all possible natural things so that your cervix is getting opened and naturally progressing into labor. And you should have very less stress in labor, and keeping the baby and the woman together as soon as the delivery happens, and giving the baby mother's side, and allowing the baby to latch the mother's breast as soon as possible, at least with less than half an hour duration. Once the skin to skin contact bonding happens, then the prolactin automatically increases, and the skin to skin contact of the mother and child is very, very important. Here comes a very important tip wherein I have seen so many enthusiastic grandmothers and grandparents and enthusiastic partners taking away that kind of a bonding between the mother and the child, and expect that the mother should be able to take rest and give breast milk also. So the more you're taking away the baby from the mother for her to rest, or for you to involve into her care regime with the child, you are taking away the bonding between the mother and child for adequate breast milk supply. So I always tell that support is support. You can do every other chores in the house other than the mother child bonding, so that you leave the mother and child to bond with each other and increase the breast milk production and give her comfort by taking care of the entire house chores and giving her adequate food, rest, and mental support. So that is very, very important. And when it comes to maximizing the role of birth hormones, that what we have seen, it is very important that prenatal education is important. Exposure to the setup and the friendly nature of the staff is important, so that you're one to one, knowing each other, expressing your griefs and taking care of your concerns and taking care of all that is inhibiting your brain. And it is all about partner support, family education, and being very good at the environment that you are in. And when you're delivering, it is very, very important that you have a very good birth setting, you have a very good labor support team, and whatever said and done, childbirth is a pathway to a healthy mother and a healthy child. So in such a setting, always you have to think about maximizing the role of birth hormones. Mother-child bonding is important for prolactin levels. The other very important things are how you can enhance the role of oxytocin, how you can enhance the role of endorphins, how you can cut down on the effect of adrenaline. So there are several methods and mechanisms that you actually need to practice all throughout your pregnancy. Keep calm during labor and childbirth, and enjoy the D-Day, because that is the day you have a very good outcome of waiting and taking care of everybody along with your family. And it is very important that childbirth remains as a beautiful experience. And this is all about the role of hormones, and we will take care, we will take it further ahead and make sure that we discuss so many other topics which are influencing pregnant women and having a normal vaginal delivery. So that's all for today, and see you again Monday morning with Super Healthy Super Mornings with Dr. Shilpi. So bye, and thank you all for watching, and we will discuss on further topics. If you want me to discuss any topic, you can send the topic name so that we will discuss it in detail. So thank you, and a happy weekend ahead.